And just as a quick, Dexter, are you on the call? Okay, not yet, but that's all right. Okay, let's go ahead and get started. So you should see an agenda on your screen here. Thank you everyone for joining us again. My name is Brian Eller with the Pima County Health Department COVID-19 Schools Liaison Team. This particular meeting today is the Tuesday meeting for private and charter schools on November 3rd, 2020. Before we get started today, I just want to make sure to remind everyone on this call, please get out, go vote. Make your voice heard. It's important. Yeah, so go vote if you haven't already voted. It's a really important part of our democracy and what America is all about. So for the agenda, we're going to get started right away with the coming up part on the beginning of this. There's two pieces that we'll discuss, and the first thing I need to make sure everyone knows about here, let me just reshare the screen here, because I do see your comment there, okay? Refresh this one more time. Okay, if it doesn't come up for right now, Ms. Sullivan, then I think it'll be probably an issue with the download system on Teams and how you're accessing it. Okay, so coming up next week, we'll have a discussion about mental health in schools and COVID fatigue, depression, anxiety, things that are really coming up as important issues that have pretty high confluence and congruence with COVID in general. So that's next Tuesday. The Tuesday after that, Dr. Lynn Gerald from the University of Arizona is going to be going over asthma-specific mitigation techniques, talking about masking and other mitigation-related guidance as it pertains specifically to students and staff with asthma. So we're really excited to have them on that call and as a part of that discussion. They've got a ton of expertise and guidance around it and have been working with the health department for a significant period of time on that specific guidance. I also want to talk a little bit about, for the rest of the agenda, because we have everything so kind of packed in today. As we go through this, please post all of your questions in that chat box as soon as you have them. I'm going to rely on my team to address a lot of those questions as we go through. So just continually monitor that chat box and just make sure that you're checking that to see that your questions are addressed. Dexter and Penny and Tina are pretty good about getting on top of those things as soon as they pop up. So at the end of the agenda, I'll circle back and make sure that everything in the chat box was addressed. But I'm actually going to ask for a different course of action today, is as soon as I get through with all the updates, Dexter and Penny, anything that hasn't been addressed in the chat, I'm going to have you take lead on that first, and then I'll circle back around and start skimming through to kind of speed us through this as quickly as possible. We do want to on the agenda today. Okay. All right. So first thing is AIA updates on winter sports and overall updates on winter sports and guidance in general. So we do another quick screen share here, and then we'll jump straight into that. Okay. So just give me a few seconds till this loads up. So this document is available at the AIA website. Let me just show you where to find that. If you go to AIAonline.org, then you're going to come to this page, and then right here you'll find the winter sport specific modifications from the AIA in general. And it'll give you your basketball modifications, all of the other modifications that need to take place throughout the season for the various teams and sports that are played in the winter session. I will reemphasize that the health department is, again, not recommending football or wrestling at this time, as well as other contact sports. Like we would classify basketball as a contact sport technically, but more moderate risk than football or wrestling. So we're actually going to be doing a breakdown of these modifications and making sure that we have a really consistent guidance and process in place. And we'll be sharing that next week at a meeting with the athletic directors and coaches throughout the county. So that guidance is going to be specifically tailored for that specific group. Again, just athletic directors and coaches. We sent out an invitation for that yesterday. That meeting, I believe, is next week. I'll double check that before we progress any further on this. It should be around 2:30 in the afternoon. It won't take a full hour to get through all of that guidance, but we do want to try and give the best science-based guidance pertaining to that to our coaches and our athletic directors, because the messaging that we issued for the fall sports season was definitely tardy. It was not on time, and if I had a magic ball and I could shake it, go back in time, I would have issued that guidance back in June, July. But I think we're going to get ahead of the game a little bit more with the winter sports, so that's why we're trying to do this as quickly as possible. So again, that's where you can find that guidance is on the AIA page, which I showed you earlier. So we talked about that. I briefly addressed the AD meeting coming next week. Again, that's athletic directors and coaches. We do have some really specific guidance on cheer and spirit line that the health department is going to be issuing separately, similar to what we did for football. The reason for that is because we're seeing a lot of transmission on cheer and spirit line teams. I've had a couple of I would consider them outbreaks at this point among high school cheer and among spirit line. I can't give you enough reasons as to why that is at this point in time. We're still kind of running some analytics on that. The really important thing for folks on this call to know is that a lot of that transmission is taking place. There's been cases where it's been in practice among those cohorts, but also outside of school activities. We're really struggling with how do we get the message across that you should not be eating meals outside of school together. That's been a really big point of disease transmission, is during these like meal events and other outside activities where people have not been masking with fidelity. And those particular instances have caused really increased rates of transmissions and have been the center points of outbreak amongst these groups or even teams. So it's really, really important that you all are very clear with your coaches, with your athletic directors, that your teams should not be engaging in these kinds of activities. The AIA, on the previous call we had with them, with athletic directors and coaches, were very clear in their guidance pertaining to that, stating that any coach who did not meet these mitigation guidelines and guidances for teams would be suspended from play for that season. And we 100% support that stance. So as the administrators at your facilities, or as teachers or as coaches and athletic directors yourselves, it needs to be very clearly communicated to your athletic directors and your coaches that your teams really cannot be meeting outside of practice or play. It's already a risk for them to be playing in a pandemic in full games or practicing together and not maintaining social distancing and not masking. So increasing the rate for that risk is only going to hurt our communities even more. And when I reference hurting the community, I reference putting people who are at heightened risk, high risk folks, because, you know, let's be serious about this. We have a lot of folks that have multi-generational housing, a lot of folks that live with grandparents or whose caregivers are elderly, above 60. There's a high population of that in Pima County. And if we're going to approach this from a sense of equity, it really leaves a lot of people out of the picture if those folks are excluded. And again, the health of the community is what we're really trying to prioritize as a health department. So if you're gonna do the sport thing, then please make sure your teams are following the mitigation guidance, okay? And again, we'll be issuing out, hopefully by end of business today, we'll have another memo similar in structure to the previous football memo that was issued that specifically addresses cheer and spirit line, because we've seen a high occurrence of outbreak transmission amongst those specific social circles, okay? Next thing on the agenda, just moving into updates, we have 6 updates to share with you today. The first of which is that Arizona Department of Health Services is launching a campaign called Healthy Schools. And one of the hashtags for this has to do with healthy schools and equal healthy kids, right? But we're looking at the verge of that, possibly doing another campaign that's Healthy Kids Make Healthy Schools. This campaign is going to feature all kinds of photography-based messaging with kids of all different demographics wearing masks and engaging in some type of active behavior. The general message is that we think it's important that kids get back to school in a safe way, right? So how you go about addressing your mitigation, and I have to just kind of footnote this with Pima County has done an excellent job with this so far. 90% of the schools that I've been interacting with and that my team have been interacting with, and I would say even 95%, and that's just an off the top of the head figure, it's not based on the actual data, have been very good about following mitigation practices and guidances that are going to keep our students safe and that are going to prohibit outbreaks in school settings. The more we adhere to that mitigation, the better this is going to be for our community. So look for that campaign to come up soon. If you as a school or as a district are interested in having some of this media messaging paid for by the state to be either put out on your social media or having a billboard near your school or a bus stop poster or something, go ahead and email us at eoceducation@pima.gov. I'll have one of my team again just kind of post that email address in the chat box, eoceducation@pima.gov, and we can make the connection between the state and your district or your zip code to get that messaging in place. Next meeting, we'll have some previews of what that messaging actually looks like, so you can see some of that. But just know that that's something that's available for you. Okay. The dashboard for where that campaign will be taking place will be adhs.gov/healthy schools, and that is on the agenda. That website is not live and active as of yet, but it should be within the coming week or two. Next on the agenda is the ADHS dashboard, updated dashboard. So we've seen some updates on this throughout the week. So I just want to go back and touch base on this and kind of show where we're at with this. When you click the school's dashboard, this is what comes up. I went ahead and just filtered it out for Pima County as a southeastern region here. So we can see that we've kind of, our disease data has moved, there's an upwards trend here. We're now at as of October 11th, remember that our data gets backdated by 2 weeks because that's how long it takes for ADHS to update all of this. This is for October 29th, and we should see this updated again on Thursday. But you'll see that we're up to 82 per 100K as of last week. As a school liaison, being a recipient of the cases, I'm actually expecting this to jump up again next week. The health department is going to maintain the stance of hybrid education being a go. We want to try to get kids back in schools in a safe way, and we still believe that it's safe to operate in a hybrid model. We're going to see a spike in cases for a couple of reasons. I can address specifically the one of our local penitentiary outbreak. A really high jump in school-specific cases, and that's because everyone's been coming back. We're actually running an analysis on the amount of outbreaks that have occurred in schools, and compared to outbreaks in other counties, so far we're doing pretty good on that. We expected a couple of these to happen. We've had about 10 so far across Pima County, and we'll have a more updated analysis ready on that later today. So next Tuesday, you'll hear an update on how many outbreaks have occurred in schools. Each one of these we have to kind of consider on a case-by-case basis, so it does take a little bit of time. We're trying to reevaluate that process so we can get a quicker turnaround on the official declaration of whether or not the school has had an outbreak. An outbreak is consistent with 2 or more epidemiologically linked cases within one classroom. So that means that the transmission has most likely occurred within the school setting. There is some other guidance that we want to issue in relation to that, which we'll come back to later on the agenda. But those are important points to consider. So again, I want to reiterate, we are seeing an increase in percent positivity and disease data throughout the county right now. But we are going to maintain our stance on hybrid education as a go. And even if we see that disease data go into the red and the low red, we're going to maintain that stance of that disease, that hybrid instruction being a go. I know there's a couple of chats in the box there, and again, we'll come to those at the end of the agenda. Penny and Dexter, if you want to try to get ahead of that and just address those as they come in, and Penny's already. Other updates, close contacts, to just reiterate this guidance again. Close contacts are over 24 hours, 15 consecutive minutes or more over a cumulative, so 6 feet or less for 15 minutes or more cumulatively over 24 hours. I just want to reiterate that because it's, I know it's fairly new information in terms of it's come in within the last 3 weeks. So those close contacts are for 15 minutes or more, 6 feet or less, cumulatively over a 24-hour period of time, okay? We did update our graphic visual on that, and I'll post a link to that again in the chat box. And that same link, if you've had it from a previous session, should still apply. So you should be able to click that link and see the updated document that states clearly cumulatively over 24 hours time period to constitute close contacts. We've seen that already increase the amount of close contacts in the cases reported by schools, which is part of the reason that we're having an increased caseload. But we do think that as a definition, it functions in a much a more accurate way to portray who constitutes close contact within the community, which in turn helps our contact tracers and helps our contact tracing to be more accurately reflective of disease criteria throughout Pima County. So that's important information, okay? Next up on the agenda is outbreaks in schools. And yeah, so again, we've seen a couple of outbreaks so far, about 10 in total, and we're gonna have a more definitive number for you on next Tuesday. That makes sense because schools are going back, and we're doing an analysis on how many of those outbreaks are athletics and sports related. Because if you look at the larger scope of how many outbreaks are taking place in classrooms, there seems to be a disproportionate amount of those that are related to athletics. That's just, that's not a, at this point, that's not a full analysis related statement. So just note that. We'll have definitive data on that in the next week to just full out state that, whether or not that's a theory or a hypothesis at this point. So we need to have that backed up with data, which makes me hesitate as to why I should have even said that in the first place. But that's just to kind of see, well, that's based on what we've seen on the numbers and cases being reported into the health department, and as those relate directly to outbreaks. What constitutes an outbreak, again, is 2 or more epidemiologically linked cases within a school setting, and to be even more specific, within a classroom. We've seen a lot of schools that have reported 2 or more cases in under 14 days. And most of those, we've been able to have a follow-up call with either the administration or the case reporting. Some of those we haven't had to, because I've just had a conversation, or Penny's had a conversation with the person reporting this case. And it's really clear that those cases are not linked, because those students have either been hybrid remote, or those students have been clearly linked outside of the classroom. And a demonstration of that would be siblings, household contacts, cousins who met up at a park in an outside setting. There's been a slumber party in one case. There's been several parties actually that have occurred where it's really clear that that's where disease transmission has happened. But there's also been things like basketball tournaments and mealtime events and things of that nature. So the outbreak, when we declare an outbreak, it's only when it's like clearly been shown that contact, that close contact resulting in disease transmission has taken place on the school site within school hours, which is bell to bell at this point. Okay, so those are important things to know about what constitutes an outbreak. And we'll come back and address further questions in that, so feel free to post those in the chat right now. The isolation space guidance is the next thing on the agenda. I'm going to do a quick, just jump back over to the agenda so everyone can kind of see referentially where we're from in case you don't have the agenda up on a shared screen. So let's just jump back to that really quick. So you can see we've gone through at this point the coming up piece. We've gone through section B, which is the winter sports updates. And we've gotten into section C of updates here. I talked about the campaign launch. Here's the website where that will soon be landing. The Arizona dashboard and metrics, which there's a hyperlink right here on the agenda. You can click to follow that to get into that data that we reviewed on a screen share. We talked about close contacts cumulatively over 24 hours. We just finished up with outbreaks in schools. So I'm just going to briefly point out the next 2, and then we'll jump back over to the screen share on the interwebs isolation space guidance, which we'll check that link here shortly. That's a fairly new resource that I was just made aware of that will really help a lot of your school nurses, health aides, and anyone else where you've got a student who's either presented positive for campus or has been identified as a close contact who's in your school at the moment. And this is pertinent for a couple of reasons. I'll talk about that in a moment, but it relates specifically to closing the loop on contact tracing and case investigation. And I'm actually going to spell that out because as a health department, we, as a government agency, we tend to get into acronyms fairly easily. Hold on, sorry, just editing live here. Give me 2 minutes to just pull down to this. Contact tracing case investigation. And I just want to briefly talk about the difference between these two because it's not super important to know, but it is kind of there is a difference between the two. Case investigation is specifically for certified positive cases, confirmed positive COVID cases. So that's when someone from our Maximus team who's got a positive test result, and they're actually asking that person, where have they been over the past couple of days? Who have they been in close contact with? Are you isolating appropriately? Isolate for 10, quarantine for 14. And do you need any resources as you're in your isolation period of time, right? So that's case investigation. Contact tracing is for anyone who's been in close contact with a positive case. So this is someone who meets that criteria of 48 hours previous to test or symptom onset of a confirmed COVID positive case, or someone who's been in close contact throughout the duration of that symptomatic or time before they were notified as a case. Hopefully people who are isolating are not going out into the community and getting into close contact with others. We've seen that happen, unfortunately, and that has a lot to do with misinformation, I think, or just disbelief that COVID is a thing, but it does happen. And I wanna just take that 48 hours for a second and address that for a quick minute, right? So 48 hours is the timeline for which we are defining as a close contact, and that's different from 2 days, right? This is important because there has been specific examples here in Pima County where the guidance was issued based on Pima County's part, where I've said 2 days previous, just interchanging that for 48 hours. And that's important because if a confirmed case, let's say today at 10 a.m., I started developing symptoms, and 2 days ago at like 7 a.m., that would fall outside of that 48-hour window that close contact would count for, okay? I think a graphic visual will probably help with this a little bit more. So I'm gonna draw something up here in a minute to demonstrate that exactly, okay? But just remember, it's 48 hours, not 2 days, when we look at close contact and in terms of the contact tracing piece, okay? And who's been in close contact with a positive confirmed case. And that's a 48-hour window from the time of taking a positive test date if you're asymptomatic, or 48 hours from point of symptom onset with a positive confirmed case, okay? Let's jump. You're not seeing the agenda, are you? Let me reshare that agenda just for a moment. I just noticed that. There we go. Sorry about that. Okay. So here you can see where we're at with this. Okay, so we went over the AI updates, and then these updates, we're right here on number 5 and 6, isolation space guidelines and closing the loop on contact tracing case investigation. Awesome graphic visuals detailed out for that in a minute. So we're gonna check out this link really quick on the isolation space guidance. So let me go ahead and pull that up for a quick minute. Okay, and you're all seeing that, that's good. So this is from the National Association of School Nurses. And right here, it gives some pretty good guidelines on isolation space. I think we've touched on this before in previous webinars, but there's some really good, there's some more specific guidance on how to establish an isolation area that is probably a little bit more stringent and more detailed than what we've provided in previous webinars or via our mitigation plans that we were developing and putting out at the initial onset of the, or at the initial development of the school's liaison team. So there's some good information in here. You can find that again, linked to the agenda that was sent out this morning. If you need that agenda, just go ahead and drop your email in the chat box. Just say need agenda, and either Penny or Dexter or Tina can get that sent out to you during the session today. Okay. All right. So let's go to the last piece here. We'll jump back over to the agenda for that. We'll get that agenda to you. Thanks y'all for dropping that in the chat. Okay. So the last piece is closing the loop on contact tracing case investigation. We've heard a lot of feedback based on the last the last pieces of guidance we've talked about in terms of quarantine and isolation and how it's being issued out to students and families from our contact tracers and case investigators. So previously we talked about this rolling quarantine isolation being the end of loop guidance, right? And that's the guidance the health department will offer, and that's what you should follow. So we've had some subsequent conversations with our contact tracers, case investigators, which keep in mind they have to follow a process for the entire county, and to get them to kind of hone in just on schools related guidance would be impossible. So we've adjusted our messaging around that to be essentially that contact tracers and case investigators will issue the isolation and quarantine guidelines on a case-by-case basis with the individuals from schools with which they interact. So there's a couple of things that you as school liaisons or as school point people or point of contacts within your schools can specifically ask for from parents or guardians who are being contacted by case investigators or contact tracing. This is really important, and I'll make a note of this on the agenda before we send this out in notes today. You can ask those parents to provide documentation from contact tracers or case investigators related to the quarantine and isolation release. Those case investigators, contact tracers will not provide that documentation without it being requested by the parents or guardians or the case themselves or the close contact themselves. So we're trying to figure out how we can get this messaging out to the broadest audience as possible. But you as points of contact with these parents or these guardians directly, because so backtrack. When a positive case or when a contact is identified and is made contact with our contact tracing case investigation team, they're going to be getting a daily check-in. Every 24 hours, they're going to be getting a call or a text from those contact tracers, case investigators. And when they have those conversations, we have to encourage those parents to ask for written documentation on release of quarantine or isolation, okay? When they get that, that's something they can physically forward over to you as a point of contact at your school site to say, our quarantine or our isolation ends on this date, okay? So there's no way that we as a Pima County school team can actually, that we can ask for that to happen across the board. Last week, we had 101 positive cases, and that was just the cases. That doesn't include all the close contacts. I have to say there's easily over 500 close contacts within that list that were identified. There's no way we can manage that with a team of 4 and effectively 1.5 FTE full-time positions that we can wrap that up with every single case or close contact. And the best way we figure that out right now to have that happen is to have our points of contact at the schools directly who are interested in the quarantine or isolation and time period of that. So when they have when they field the phone calls from parents, or when they have follow-up calls with the parents or guardians, to be the ones who ask that parent or guardian to say, hey, you can ask for this documentation, and please ask those contact tracers, case investigators to provide that. There's 150 different contact tracers, case investigators, who right now, to change that process for the entire system of Maximus, it's going to take us 4 weeks at least to change that. It's that difficult. And that's thinking like really Pollyanna. That's a real Pollyanna approach. So I think if we were to realistically look at how long it's going to take a process for us to just flag schools and have those cases just be provided that written guidance automatically, that it would be impossible to do in a timely manner. So the best way we can do that again is for you as school points of contact when you talk to parents or guardians who are on quarantine or isolation, to ask them to get that written documentation from their contact tracing or case investigation team through Maximus, and then in turn to provide that over to you as a point of contact. That's the best way we can do that right now. And we'll have that written out for you. We can include that on the notes today if that's needed. So that concludes the agenda at this point. We're going to turn over to the chat box and address any questions that might have come up at this point.
Brian, first of all, can you put up the link to the NASN stuff that you had on there? The National Association of School Nurses.
Yeah, if you click the link for the guidance in the agenda, that will come up. Let me go ahead and just go to that website and post it in the chat so that people can get that. So that's be a quicker way to get that out. Okay, so you'll see that link pop up in the chat here. Okay.
Thank you.
So a lot of these we'll review post the session today. If there's requests for things to get sent out, we'll send that out afterwards. To address Mr. Clark's question, I don't have any information, and we are struggling with trying to reach out to club sports. I do have a meeting at FC Tucson coming up, hopefully this week. Football Club of Tucson, which is one of the largest soccer leagues here locally. But if you have any ideas, Mr. Clark, of how to connect with club sports teams in general, I would be very receptive to that moving forward. So yeah, just let us know if you've got contacts there that we can touch base with. Ms. Huff, I think, oh, perfect, Penny, awesome, thank you. And we're going to deal with school staying open. Okay, yep, that, good, thank you. Next down, we've done the Sean Clarks. So here, Penny, let's do this. I'm going to read out the name and the time. If you or Tina's already addressed the question, just go ahead and say already addressed it, and then I can scroll down more because it's too hard for me to kind of skim through everything.
Sorry.
So the next question is from Mr. Sean Clark at 9:22 a.m.
No, answer it.
Okay, great. So the recommendation to remain in hybrid has a couple of things to do, Mr. Clark, with this increased spike. We do feel like there is a level of comfort that we are, as a health department, with in terms of the hybrid, return to hybrid instruction. One is that it's going to be, we don't want schools to have to shut down and then reopen again. That's going to cause a lot more stress on the community than just remaining open in a hybrid model. And even though we're seeing increased rates in school cases, it's still at a level with which we're as a health department are comfortable with seeing at this point. There's a couple of reasons for that, okay? One has to do with the main guiding principles that the county overall has come out with saying. We have to recognize that there is a level of harm socially and emotionally that happens to our children when they don't have the ability to connect at a certain level, right? We also believe that schools overall in Pima County have done a really great job with everything that's happened this year, presenting really detailed and intense mitigation. And the level of transmission within schools as a whole has been fairly minimal. Where we're seeing transmission is in community-based settings. So it's been those meals after school, those events after school, in athletics and return to athletics, whether it's practices where they're not following mitigation guidelines or they're not following AIA mitigation guidance. Like those have been the places where we've seen disease transmission happen within schools. I would also anecdotally say that we've seen disease transmission within exceptional education classrooms. And that's kind of like that's a really difficult area for us as a health department to navigate, because that specific population really needs resources at a much higher level than others. So that's the main reason of the thought process for why we're recommending to continue with hybrid, even if we start to get into red with a high level of cases in Pima County. The other thing that I'll add into that too is that if we start to see a lot of transmission happen within our schools, then that's a place where we're probably going to have a few more conversations and could potentially recommend a move back to remote learning at some point. So we are holding that tool back in our basket, and we will call that out if we think that it's getting out of hand and that schools are not following mitigation and there is increased rates of transmission within schools. But the amount of outbreaks, again, that we've seen within schools has been, again, fairly minimal because our schools are doing an excellent job of following mitigation guidance and strategies. Okay, so I think that answer may address a lot of the questions in the chat already.
Brian?
Yes.
Could you answer? Marlene asked, she's following up for her principal. She wants to know if there's any word on the clear face mask for teachers.
Yeah, so let me jump to that in a second. Did we get Christopher at Veritas addressed, Patty, at 9:24?
Hold on, I'm going back. As far as I know, 9:24.
I don't think we did. We've seen decreased rates of hospitalizations in the past couple of months, but Christopher, let me get back to you on that one. I'll jump back over and check out the hospitalizations for COVID-like illness. There has been a slight increase on that, and we actually had a call. I want to say it was last week, but everything's been kind of blurry over the past week in terms of timeline. Banner UMC did report an increase of COVID-like cases, but it hasn't been at a place where we've really stressed out our hospital capacity. I want to say it was like around 60% capacity at that point. So I need to go back and revisit that data and check in with some of those hospitals to double check that. But it's been, it's been much more manageable than it was at the early onset of COVID, when we had, and I want to remind everyone, we had to ship people out to California and New Mexico from our local hospitals because we did not have the capacity to care for people that were hospitalized due to COVID. So we're not in that position anymore. Our hospitals have done a much better job at both triaging and making sure that there's preventative measures put in place ahead of time. So that's good. We'll get that sent out, Marlene. Thank you, Christopher. You were not supposed to be seeing a blank screen, Sarah. Sorry. I hope that was taken care of.
Yeah, you fix it.
Sent out again. We'll do Miss Dr. Derdinger.
Brian, I've already, all the people who asked for the invite to the athletic, I've already sent them.
Awesome. Thank you, Penny. And then Miss Kayla Walker's at 9:29. If I addressed it earlier, can you just let me know? And if not, I can take a little bit more time and talk about that. So Kayla, feel free to unmute and just let me know if you need more detail on that.
Yes, thank you for clarifying.
Okay, so okay, cool. Thank you. Just scrolling down here through the comments. Oh, Kayla, thank you for posting the agenda in the chat. I didn't know you could do that. I suppose it's probably the pay-per-click attachment file button there. That's awesome. Well done. Brenda, great question. Rebecca O'Brien's got that answered. Awesome, Rebecca. And I also want to say that some technical difficulties and as well as a ineptitude for memory on my part. There were a couple of meetings that we failed to record, that I failed to record. And there were a couple of meetings that I tried to record, but just ended up being 3 hours of nothing. I don't know what happened to those. We should probably actually, and Rebecca, let's talk about this later today. We should develop a matrices or like a table of all of the meetings and try to link that in. So we're really specific about which ones that I didn't do properly or where there was an IT failure, and the ones that we do have accessible via recording. That might be a better way to outline those out. Boom, boom, boom. Okay, so clear face masks. Let's address that really quick. The only, I did get, and I think I sent this out to St. John's. If I didn't, let me know and I'll send it out again. But Dr. Carlos Perez Velez, who is one of our medical directors, more or less, sent an email out. And actually, you know what? I can probably bring this up really quick on the screen. Specifically related to clear face masks. So I'm gonna bring that up in a minute at the end of getting through these comments as they're currently posted, and then I'll have there's two specific ones that he issued some guidance on in relation to an email that I had an inquiry with him on. That he said that he felt really confident that these two types of masks, I think one is called the Humanity Shield and the other one is called the Lion's Mane or something, were really effective in terms of a clear face mask approach that still mitigated the spread the same way that a double layered cloth mask would. Ms. Joyce, 48 hours from positive test and or onset of symptoms. Okay, so let me try to restate this again. So the 48-hour close contact window, remember there's two instances where someone, well, technically three, where someone would meet the qualifications for isolation designated as a confirmed positive case, okay? So let's say individual A develops symptoms on Monday, takes a test on Tuesday, the 10-day isolation for that, and that test was a confirmed positive, right? That 10-day isolation begins from Monday because that's when the individual started showing symptoms, okay? So if you were to look at the close contacts for individual A, those close contacts would begin 48 hours prior to the onset of symptoms for that individual, okay? So that's where we mean with 48 hours. If someone's asymptomatic though, however, let's say that I was exposed and I took a test on Wednesday and there was no symptoms, right? The test was administered at, let's say, 10 o'clock on that Wednesday. It's 48 hours prior to when that test was taken because it was an asymptomatic presentation. So 48 hours prior to that confirmed positive test is when we would count those close contacts, not 2 days. Now, if someone took a test, and this is the third scenario, someone takes a test on Monday, but they present symptoms on Tuesday, but the test was a confirmed positive case. Remember, you always default to when symptoms present, okay? So you would count the 48 hours of close contact prior to onset of symptoms, okay? There may be a little bit of adjustment in that guidance in the future, but that's why I don't have anything written on that just quite yet. That's currently where our understanding is it's always going to default to onset of symptoms. But if it's a confirmed positive case for an asymptomatic, it's going to be from when the test was administered, okay? Christopher, yeah, I would echo that. For most of the schools that we've been interacting with, we've definitely seen that. Okay. Awesome. Good. Yeah, and we agree, Megan. We do want to have that written out, but I want to triple check with AHS and the CDC on that infographic before we actually send it out. So I'm going to bring up an email really quick and then just post that in the chat. Oh, and actually there's another email that I want to bring up as well. But here in a minute. Couple more seconds here. I would do just a full screen share of my entire screen, but there is some information in here that I don't want to just it would violate HIPAA for me to do a full screen share of this at this point. So give me a couple more seconds to pull up just the exact email here. And then, all right, so here we go. We do a screen share of this. So we had an inquiry from one of the local schools about this exact question. Dr. Carlos Perez Velez, who again is our one of our lead medical folks here at the health department. Just overall whoops, wrong one. Has a lot of experience with disease transmission and with COVID and things of that nature. Here we go. Okay. So this was his answer to a question around the clear face masks. And I'm just going to go ahead and copy and paste this in the chat. So he looked at two specific ones, the Humanity Shield and the Badger Shield, where there were layers of protective cloth along it. He felt appropriately mitigated the spread of COVID. So these are the pictures of the exact examples. We were looking at ESL classrooms, and ASCB was, which is Arizona School for the Deaf and Blind, as specific places where these would be contextually relevant, as well as some other exceptional education classroom settings. So I'm just going to go ahead and post his answer in the chat here, and then there's a link here in the chat for Badger Shield and then for the Humanity Shield as well. That'll take you directly to the vendor website. They're a little bit more expensive. This is something that the health department cannot provide to schools at this point. And Krista, I believe, got on last week and talked a little bit about how we can, at this point, we cannot provide any further PPE for schools. We're struggling to just try and provide enough PPE for our hospitals at this point, and our assisted caregiving centers, which are definitely our priority, especially as we're starting to see increased rates. We have seen though, and I want to just give a huge shout out to our assisted care team. There's been decreased rates of transmission among those caregiving settings, which has been fantastic. We've done a really great job of mitigating spread in those settings, which are our most vulnerable populations. And that has a lot to do with those guidance being followed stringently by those centers that's been issued by the health department. And I would also echo that for our schools that are on this call and that are on the other call. But it seems like you all have been doing a really great job of following the guidance. We appreciate it greatly, and it's definitely The only reason why we are comfortable with reiterating that guidance around, you can keep proceeding with a hybrid model, is y'all are doing a great job of following the guidance. So keep it up. At this point, we're going to go ahead and end the call. If there's any further questions, feel free to post them in the chat. Our team will make sure that everyone that posted in the chat to receive either invites or specific emails or materials will receive those emails by the end of the day. And Sarai, if you click the links in the chat that I just posted, there's it says Badger Shield in blue. You can click that, or you can click the Humanity Shield where it's underlined in blue. Just click those direct links, and it'll take you to those websites directly, so that you can purchase if you're wanting to purchase those.
I'm just going to interrupt. Hopefully all the ones who wanted invites to the athletic meeting, I've sent them all. If you did not receive it, just email eoceducation@pima.gov and we'll make sure that you have an invite to that meeting.
Thank you, Penny. Again, note that we'll be sending out some guidance for our Cheer and Spirit line. We're really going to try to get that done by close of business today. It's going to depend on how many cases we get in today. We were kind of inundated yesterday. And I just got to give a huge shout out to Penny. So Penny's been working a lot of extra hours outside of her normal schedule, does not get paid overtime for it, but is also trying to run immunization clinics on top of logging cases. And as they've been received in from schools. So Penny's just been doing a tremendous job with that. And if she has not been getting back to you within a 1 to 2 hour time frame, just know that she has been absolutely inundated with stuff and has been doing an amazing job with trying to keep up with the cases. So
Okay, I'm leaving now. I'm embarrassed. Bye.
Penny, thank you. You're really you're a real benefit to our community. I just want to give you some recognition on that. I should have probably asked permission before I did that, but.
Well, that's okay. I'm blushing right here. But anyway, whatever. Thank you.
All right. So thank you all for joining us today. At this point, we're going to go ahead and if Tina, if you can stop recording at this point, and we'll stay on for just a little bit more. Actually.